Hey, what's up guys? In this video, I wanted to talk a little bit about some of the top causes of high blood pressure. Now, there are certain things that are a little out of our control as far as our age and genetics and family history, and something called secondary hypertension, which is high blood pressure that's caused from a medical condition. But for this video, I want to focus on the things that we can actually control and improve upon naturally. Number one, unhealthy diet. A diet that's composed mainly of processed foods and simple carbohydrates is actually a recipe for disaster for your blood pressure. What we need to do instead is to focus on whole foods, plenty of fruits and vegetables, lean meats like grass-fed beef and organic chicken and wild-caught salmon, 100% whole grains, and healthy fats like avocados and nuts and seeds. Many people can see huge improvements in their blood pressure just by getting their diet back in check. If you're looking for something a little more specific as far as a plan to follow or a dietary practice, I would recommend a Mediterranean type diet or a whole foods plant-based diet or the DASH diet. All of these have shown significant improvements in blood pressure. Number two is being overweight. Now, this is another powerful contributor to high blood pressure. Some studies have shown that for every kilogram or 2.2 pounds of excess weight that we lose, we can see about a 1-point improvement in our systolic blood pressure. So, for example, if somebody lost 22 pounds, they could see an improvement of about 10 points in their blood pressure. So this is another really important risk factor and something that if you have some excess pounds to lose could really improve your blood pressure. Number three is lack of exercise. There was an important study that was just published in JAMA actually, which followed over 120,000 people over 20 years. And they subjected them to some fitness protocols and exercise regimens on a treadmill. And essentially, these researchers from the Cleveland Clinic found that the people that were the least fit and unable to perform these protocols actually had a higher chance of death from all causes than people that had high blood pressure, that were diabetic, or current smokers. So this just goes again to show that we really need to make sure we're getting some high quality exercise a few times a week. It doesn't have to be anything excessive or crazy. I would aim for 15 to 20 minutes a day, or if you can't do that, maybe do 30 minutes 3 to 5 times a week. And you can see significant improvements in your blood pressure just by being more active. Number four is excess sodium. Now, not all salt is bad for you. There are some natural salts like Himalayan salt and things that are relatively good for the body. However, regular table salt and the salt that's in highly processed foods, these are not good for you. And the average American actually consumes around 3,500 milligrams of sodium per day. And multiple studies have shown improvements in blood pressure by backing off on our sodium intake. So some tips on how to improve or decrease your amount of salt per day is make sure you're not adding more salt to your food if it's already seasoned in salt or spices. So take that salt shaker off the table. Make sure that you're getting enough potassium in your diet. Make sure to rinse and wash any foods that come in like a can or a container. And be sure you're reading the food labels. Now, your sodium intake can kind of creep up on you, and certain foods have more sodium in them than you think. So make sure you're paying attention to those as well. All right, number five is potassium. Now, potassium is something that actually counteracts the effects of sodium a little bit. It helps to, it aids in digestion, and it helps improve blood pressure. So the best way to improve your intake of potassium is to make sure you're getting plenty of potassium in your diet. So be sure to eat plenty of leafy green vegetables. Avocados are good in potassium, bananas, beans. These are all things that are rich in potassium, and to make sure you're getting those in your diet each day. Number six is magnesium. Now, magnesium can improve your blood pressure very quickly, actually. One study in particular found that almost 80% of people that take high blood pressure medication are low or deficient in magnesium. Now, magnesium helps to dilate and relax the blood vessels in the body. It also helps aid in digestion and plays many other important functions in the body as well. The best way to improve your intake of magnesium, again, is through your diet. However, a high quality supplement can also help. Number 7 is chronic stress. Now, studies have shown that people with chronic stress levels have higher chances of having high blood pressure. When we're stressed out, our bodies produce hormones such as cortisol and adrenaline, and what this does is it constricts our blood vessels and increases the heart rate in the body and leads to high blood pressure. And so some good things to do to help improve stress is make sure you're getting plenty of sleep, getting plenty of exercise, make sure you set some realistic goals for yourself and don't take on too much, and maybe take up yoga or practice deep breathing or meditation. These have all shown improvements in stress levels. Number 8 is smoking. Now, I'm not going to go into all the reasons why smoking is bad. I think we all know that at this point in time, but smoking is one of the top leading causes of preventable death worldwide. And one study in particular showed that by smoking one cigarette within 5 minutes, people's blood pressure would increase by 20 to 25 points. So significant impact on blood pressure. Highly recommend that you quit smoking. If you need help with that, be sure to talk to your doctor or get some help. Number 9 is excess alcohol. Now, excess alcohol has been shown to increase your risk of developing hypertension by 70%. Additionally, alcohol can lead to excessive weight gain and can lead to electrolyte abnormalities, which also increase your risk of developing high blood pressure. So be sure you're drinking responsibly. Number 10 is certain medications. If you're taking several medications, be sure to speak with your doctor and have them go over the medications you're on, as certain ones, such as birth control medications and antidepressant medications. These are medications that can potentially cause high blood pressure. Also, over-the-counter medications, things like decongestants and anti-inflammatories can cause elevations in blood pressure. So be careful not to be using those too often. And of course, recreational drugs, things like cocaine and stimulants, these obviously increase your risk of having high blood pressure. So these are just some of the top causes of high blood pressure. For more tips on how to naturally improve your blood pressure, check out my free book, 10 Superfoods to Lower Blood Pressure Naturally, and check out my links below. We'll see you in the next video.